Hi, my name is Sean Luong, and I'm here to talk about utilizing a comprehensive paracentesis module to improve paracentesis teaching. I am with UT Southwestern, and I work at Parkland Hospital. Our question was, how do we optimize the limited time that medical students had to learn paracentesis during the residency essentials course? For our learners, we took a survey on how comfortable they felt practicing paracentesis under supervision, and over half responded on a Likert scale that they were not comfortable with a response of 1 to 3. For our study, we had half of our internal medicine track students review the standard New England Journal of Medicine online video, and half of them were asked to review a new module designed by myself to be more comprehensive to explain the roles of paracentesis, as well as review liver cirrhosis and the complications of ascites. The outline of the module included the indications for paracentesis, the labs to review prior, how to obtain informed consent, gather the materials, prepare the patient, the actual demonstration of the procedure, identify the labs to send, how to interpret them, anticipate post-procedural complications, and then the documentation of the procedure. The learners were divided into groups of 2 to 3, and they had around 30 minutes to learn paracentesis. There were instructors, one instructor per group to initially introduce the kit, the ultrasound machine, as well as demonstrate the process. Afterwards, the students had roughly 8 to 15 minutes of time to practice the procedure independently. The students, as you can see here, were divided into groups A and B, one being the control, one being the intervention. They all filled out a pre-practice survey. They either watched the standard New England Journal of Medicine video or the comprehensive module. They practiced the paracentesis on task trainers. In a separate day, they came and took a multiple choice quiz. They practiced the paracentesis observed by a faculty, and afterwards filled out a post-practice survey. We found that the didactic quiz score was significantly higher for the intervention group. The actual numeric score on the assessment as observed by faculty or resident was higher in group B, but it was not statistically so. However, the actual pass rate where the learner was deemed ready to practice on patients was statistically higher in the intervention group compared to the control group. Interestingly, there were 9 students initially assigned to group A who were not able to practice in the simulation lab prior to their assessment time due to a schedule conflict. Those 9 students had similar quiz as well as numeric assessment scores, but they were all deemed not yet ready to practice on a live patient. Afterwards, all of the students responded being more confident in the post-practice survey. Their score was around 64 students replied on a Likert scale of 4 to 5 out of 74 students that they were ready to practice. In our discussion, we feel that the comprehensive module detailing the paracentesis procedure seems to be more effective in preparing the students to learn paracentesis. This is based on a higher post-survey confidence reported intervention group B compared to A, as well as a statistically higher pass rate in the students in group B. Also, having hands-on practice time under supervision is key in addition to the didactic learning. As noted by all of Group C who were not able to practice, they were deemed not ready to start practicing on live patients. This project was sponsored by the UT Southwestern SWAT Fellowship. My mentor was Dr. Wan Lee of the Pulmonary Department. Thank you.